Hey there, I'm Dr. Amy King, otherwise known as Dr. Amy, and this podcast is The Most Important Medicine. If you don't know me, I'm a licensed psychologist, trainer, and consultant, and on this podcast, we're here to discuss how talking about trauma and providing a space for physicians and healthcare professionals to share their experiences is how we will transform medicine. I work with physicians and healthcare organizations on the daily, and every time we begin these conversations, and I even hint at the discussion about trauma, I'm met with one of two things, either intense, compassionate curiosity or a whole lot of skepticism. And that's what we're here for, to make understanding and discussing trauma accessible, and even more important, how we respond to trauma so that you feel more competent. Every time you join me on this podcast, I want you to hear practical information and leave with tangible tools that you can use with patients today. So I'm super excited today about my guest. This is Lisa Springer. She is a nurse, yogi, and adoptee. She's been a nurse since 1992, working in oncology, hospice, and postpartum areas. She now works as a trauma-informed yoga teacher at Monte Nido Treatment Center with teens and young adults with eating disorders. She also has classes at local hospitals where she brings healing to the medical community. Lisa is also an adoptee. She was fascinated with bonding. After 20 years being a nurse, she took on the role of maternal mental health and became a trauma-informed yoga teacher who ultimately transitioned out of nursing during the pandemic. She's passionate about how trauma impacts healthcare providers and wants to help them find ways to create a therapeutic space with patients. Welcome, Lisa.
Thank you. Thank you for having me.
Absolutely. I'm so glad you're here. Well, that's kind of your formal introduction. Tell listeners a little bit more about who you are and how you came into this work.
I've always been really interested in yoga, and I wanted to be a therapist, but I took the route of nursing because I had moved away from my home. And just the more I noticed that the trauma of my adoption started playing as I was a postpartum nurse and seeing moms bonding, I started getting curious about that. And when I'd go to yoga, I'd feel these things. So I did take a trauma-informed yoga, and it was there that I felt like I had come back in my body, and I started learning like, oh, wow, I've been very dissociated throughout my life. And that was about 5 years ago that this healing started, and I became so passionate about it. And I found my biological family, and so many things make sense. And as a nurse, I would always be like getting the anxious patients because I understood that. And I feel like I just have this beautiful gift from all of what happened to be able to hold space for people that experience anxiety and trauma. They might not even know that they have trauma. Like me, it took me 50 years, because adoption was a blessing too, as well. So it's all a gift. And
And would you say that all of that started by being more in touch with your body through yoga?
yeah, because before I would tell these stories of I had some abuse in my history, and I would not even shed a tear. And then I would go to yoga, and all these tears would fall, and I would almost like, what is my body doing? And then I read about it, and I'm like, my body is meant to take care of me, and I can teach this to people. And I know so much about the body as a nurse. And then it became like, I can't hold this information back anymore. It's too powerful.
Wow. You used the word dissociate a little bit ago. Would you describe for people in your words what you mean when you say dissociate, and why it feels protective at times?
I really struggled with dysthymia growing up, and I've been in therapy a lot, and I had a great family and everything, but I think that in order to protect myself, I would just kind of space out and not be, because I was trying to figure out who I was, especially as a teenager, that identity stage. And the more I got to know my roots, then I would be like, yeah, I have these things, and yeah, that feels right. But I didn't have that mirror imaging. And I love my parents, but it's like I always did feel a little bit not. And that whole adoption thing is a whole shocker too. It's
Mhm.
like, but I have even more love. Like, it's so healthy to be able to talk about it and not have the shame of feeling like I'm going to hurt my parents.
Mhm.
So,
You know, it's interesting. You're giving a lot of really good nuggets for people that might be working with a patient who's kind of describing, to them that they feel sad or dysthymic, that they feel kind of checked out from their body, or that they'll have these like physical symptoms come up, like crying. You mentioned like crying in yoga, that they don't know where it's coming from. And what I'm always wanting physicians or other providers to be thinking about is like, maybe that's trauma. Maybe there's something else going on. And for you, that was your body's way of acknowledging the trauma internally.
yeah.
Okay. How, in your own words, Lisa, how would you define trauma?
Trauma is anything that I believe that is not a normal occurrence, and the body cannot adequately cope with it. That's
Mm.
how I look at it. And and there's so much shame around the word trauma. It's like, even in the yoga field, like, everything is a lot of them, it's like, let's talk about the light, and but in the darkness is where I found the light. So it's like being able to approach it in a very soft and curious way with compassion. That's how I've, like, instead of this dark, gloomy thing, it's actually brought to light. And it's like, that's where I find my identity is, I was born with light and all those things, and I'm not my story.
Wow. I want people to hear what you just said, which is, it was in the darkness that I found the light.
Mm-hmm.
There's
Mm-hmm.
so hard often, like, and you practiced nursing for decades. It's so hard for people to talk about trauma because there is so much shame and there's stigma around it. If you put on your hat as a nurse, how might you begin that conversation with a patient, or how might you ask them about trauma? Because it's hard.
Mm-hmm. Usually I could like feel that something wasn't right, because I feel like growing up in a family that I wasn't biologically connected to, I had that of feeling my way around. And so I really come in with a non-judgmental attitude. There's so much bias, and I mean, we all have bias, and I do it, but I was like, I need to check myself, because I don't know these people. And I really, it's like, when I gave the people the space to actually, and just my demeanor, the way that, you know, just even the breathing, or just bringing down the energy,
Mhm.
um, it could make a patient experience like night and day, and giving them the time that they need to, and looking at them and seeing them with eyes of compassion and not judgment. Yeah.
Mhm. Okay, so I'm kind of taking notes for folks, right? Entering into the space, being non-judgmental, breathing, being aware of the energy and trying to kind of bring the stress level down, giving them time, right? Versus having your hand on the door or rushing through notes. And you also just talked about a lot of like nonverbal cues, right? Just being present. I think you said compassionate eyes, right?
Mhm.
People know the difference, don't they, between warm eyes and cold eyes?
Mhm.
Yeah.
Like they say, people remember how you make them feel, not, what you, or talking down to someone. It's like, it's so scary to be in a hospital,
Mhm.
and like, basically just breathing with that patient and seeing what like, they are the patient, and I'm not like this dictator. I'm honored to be in their space, like, so.
Wow, that's a
Yeah.
really
Hmm.
nice approach. And you said, coming into that space with non-judgment because I don't know what they're going through.
Hmm.
What do people not know, right? Like, you talked to me about going through COVID.
Hmm.
Still going through COVID. If you're listening right now, it's September of 2022. We're still, World Health Organization says we're still in a global pandemic. What did people not see in you or in other fellow nurses?
I think the thing that was really missed, which was so frustrating to me, was, but I understand it, that there was so much fear that we didn't get the time to breathe. We didn't get to make adjustments for having a mask on our face all day. Like it was like we were robots and not humans. And I
Mhm.
think even a few minutes, taking that time to just bring practitioners into that window of tolerance, like, like that's a whole nother topic, but just like having that knowledge, it helped me so much through the pandemic, just learning how to breathe and just hold space for room, and like just the anxiety level was just too much.
Yeah.
Hmm.
I mean, I think it's worthy of, I'm going to do like a quick PSA for folks. There was actually a study that was done at the beginning of the pandemic through UCSF, University of San Francisco. And what they found out was that when they went into ERs and worked with physicians and nurses around their PPE gear, if they could get them to get to a space, take off their masks and breathe for 90 seconds, not 9 minutes, not 5 minutes, 90 seconds, it decreased their cortisol by 30%. And
Wow.
so, I've heard you say several times now, being aware of the energy, breathing, that as nurses, you were scared and you didn't have time to adjust to wearing masks all the time or
Hmm.
just being able to breathe. But in actuality, there's been research done now that we have to give healthcare professionals time to do some deep breathing, and it really does reduce their stress. So I just want to put that out there. It's a really valid
Hmm.
point.
Hmm.
What shifted you away from nursing and into this space of yoga and trauma informed work?
So we have like different levels of nursing. So I was really connecting with the women who had postpartum depression, and um, so with that, I got a clinical 3 level job, and that was all about the time that the pandemic happened, and I was working in support groups and teaching people how to breathe, and that kind of all went by the wayside. And I just noticed we weren't taking that time, and it's like everyone was being rushed out a day earlier. We were getting more patients, and it was kind of like this attitude of, this is what we're called to do. This is what, and I felt like it was bullying myself
Mhm.
after a while, because I'm the type that will show up and work, and then it got to the point where I was actually overworking. And I listened to your podcast, and that was something, it actually made me feel good, because a physician said that you overwork, and you're actually not as efficient. And my work was getting criticized, like little things, and I didn't feel safe. And I've been there over 20 years, and my body, I was so in tune with my body and my breathing. My body actually just like walked out. I just said, I took a leave of absence, and that's a hard thing for me to do. I'm like, I'm going to be in there and caregiver, but it was probably the smartest thing I did. But, then I jumped into hospice and overworked, and then I got COVID. But I had to, it's like we all have to learn that the caregiver needs care.
Oh, I mean, we can't overstate that, right? This idea, I'm going to introduce a word that some people may not have heard of, duality, right?
Mm-hmm.
I can be an incredible healthcare professional, a nurse, a physician, and also be someone who's tired, also feel overworked, also feel emotionally exhausted. And ultimately, what you're talking about is this term that's being thrown around called moral distress, right? When it's like, what I think I should be doing as a nurse, what I think I should be doing for my patients, I'm not able to do because there's not enough resources. Like you said, patients are getting rushed around, discharged early, it doesn't feel safe. And this horrible feeling that we go into these professions as helpers, and now we're not able to do what we signed up to do.
Mm-hmm.
It creates huge amounts of distress. So ultimately, you turned toward a space that provided you light.
Mm-hmm.
So are you a certified yoga instructor now?
Yeah. I've been teaching for like it's kind of how my path took me, and I got trained in domestic violence, and I was seeing so many of these types of patients and the resources aren't there for them. And it was heartbreaking to me.
Mhm.
And I just felt like ethically I needed to be a part of the solution. And I did work I moved from California to Oregon because I needed more. I'm just more a calm person. It was too much go, go, go. And, I ended up getting physically sick and stuff. But I worked in rehabs and doing restorative yoga. And these people were just like, wow, my breath is power. And it's like, I'm powerful, and not seeing them as an addict, but a person.
Wow. So you're talking about this goes across sectors of addiction, domestic violence. You're working in eating disorders now, right?
Yeah.
Um, just this idea of being more in tune with our body, right?
Mm-hmm.
Why would you say, and I'm a believer, but for people that are listening, why would you say that being in touch with our body, paying attention to our breath is an important part of being trauma informed?
So much I would realize how much I was in my head because I was on the computer. I was always figuring out, but the quality of my breath is often the quality of my thoughts and how much better I can function. And I mean, I was a nurse for that. I seriously didn't know how to breathe, and I had to learn, like, slowly bring it in and do that and it gave me power to be able to do that with my patients. And then it's like when you feel their energy go down too, it's like, now we got this. And just staying in mindfulness, things like that, so powerful.
I love what you just said. I wrote it down. The quality of my breath is the quality of my thoughts.
Mm-hmm.
I
Yeah.
was talking with an EMDR therapist on an earlier episode, and she talked about the importance as professionals that we have to be grounded first
Mm-hmm.
before we can ground our patients. And you're saying yes, and even before we can make decisions about our
Mm-hmm. Mm-hmm.
just being able to slow down. I hope somebody's listening and they hear that and they go, oh my gosh, I'm going to just try to slow down and do some deep breathing in between the decisions I'm making.
Right.
Yeah, yes. And so if you can't see Lisa right now because you're listening, but she has like one hand over her heart, one hand over her belly. That's one of my favorite ways to do deep breathing, just to be centered with your body.
Mm-hmm.
I even have nurses and physicians that I work with who do mindful breathing in between exam rooms, just taking some soft steps instead of rushing into the next patient room, looking at the chart really fast, whatever the case may be, just slowing down. And as they take steps, just taking deep breaths,
Mm-hmm.
and exhaling. So, oh goodness. So on this podcast, we talk about how trauma presents in patients and sometimes in healthcare providers.
Mhm.
What would you say is important for healthcare professionals to know about when it comes to recognizing trauma, right? That it might be overt, but it also might be really subtle.
It comes to mind this one patient that this is right when I got into the yoga, and I came into her room and everyone was saying that she was, and that's what, that she was, she was crazy or insane, whatever the label was, because I think that they don't, that we're not trained, and it's intimidating and scary for us. But when I saw her rocking side to side, I'm like, she's regulating herself. And her partner was so awesome. And he's like, that's what she has to do to get grounded. And it's like, I could just give her that space, and she didn't feel judged. And then she could get herself to where she wanted to be. And it was really beautiful.
Mhm.
So those kind of things.
You may have been the only person in that room who saw her.
Mm-hmm.
Wow, that's pretty powerful.
Yeah. Yeah.
So now in your work doing yoga in eating disorders, what does that look like?
We've just been virtual, but and I just, instead of looking at their behavior, I just I tell them when we get there that you've already done the hardest part by showing up, and then just allow them to find their breath. And I just say, if we're all doing the same thing, then we're not in our bodies. And then just reminding them that we all have worth, but we're there for the same intention of getting healthy, and that there isn't judgment. It's like, this is a magical, sacred space where you could just be you. And trying to and I keep reiterating that it is very scary to be there, to show up. And like, I can't even imagine at that age, instead of being like, oh, like me judging them or feeling uncomfortable because they're not doing what I tell them to do. It's like reversal. Like, I have to dig deeper into my own trauma in order to hold space for them. I always just feel so lifted, and they challenge me, and I'm just like, and they're just like, I did that.
And I think about, like, I've worked with eating disorders in the past, and there's so much loss of control that happens, right?
Mm-hmm.
Often they don't get to control what they're eating, when they're eating, how many therapy sessions. So you're giving them control back too,
Mm-hmm.
and helping them trust their bodies.
Mm-hmm.
Wow. Yeah, that's I imagine transformative. You also mentioned just now you have to like work through your own trauma to be
Mm-hmm.
present for them. Can you say a little bit more about how important that is for healthcare professionals to be doing that, their own internal work?
It's, I think if I'm feeling any judgment or taking something personally that a patient did, I need to ask myself, why is this triggering me? What's going on? Like, instead of getting defensive, or that it's like, what do they say? If there's hysteria, there's a history in it. And I just learned so much in yoga that is so beneficial for being a nurse. And just being more compassionate with myself, because nurses we're so hard on ourselves. And it's just like, we don't have to be perfect. And just coming in softer, and with ease, and being curious, and it's like, we don't have to have all the answers. And every patient they teach us something about ourselves, really.
Mhm.
Yeah.
So just to recap for people, I appreciate so much things you're saying. First of all, asking yourselves as a professional, if I'm taking this personally, I'm probably getting triggered. What's getting triggered,
Mm-hmm.
right? Having self-compassion. I really think I'm completely with you on this, Lisa. I think especially physicians and nurses don't engage in self-care because they don't have self-compassion. Just
Mm-hmm.
the ability to say, I need help, I'm overwhelmed, it's okay to not know, this feels really hard or scary for me. And once there's self-compassion, then it's like, of course I should take care of myself, of course I should, be more balanced and meet my needs because I have compassion for. So I love that you're saying that. And I really appreciate what you're saying about increasing your curiosity.
Mm-hmm.
Say a little bit more about what that looks like.
So it's with when I believe that when you come to your mat, it's a time to come and balance yourself, and it's not a time to be critical of yourself. And all of this took many, many years, and I still fight my brain, but it's like I'm living this experience right here, right now. And it's a lived experience through me. And it's not like I can't do this perfect enough. I have to do this headstand. Nope, I'm going to accept where I am today. And I'm like, I think this is the way that we're supposed to be living, because a lot of my life I lived in survival mode. And if I appear like I've got it all together, then it's all good, and then everything kind of fell apart. And I was like, okay, well, might as well try the yoga. And it was so scary, 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 but so freeing. And I don't even feel like my work is work now. And I do have more balance. So it's very rewarding.
Yeah. I mean,
Yeah.
it sounds like you have found like your sweet spot in terms of healing and doing it in a way that's genuine to you and to your body.
Mm-hmm.
Um, so when you thought back to becoming a nurse, right? 1992, you'd been doing nursing for many, many years. And I think sometimes people in healthcare feel like this is what I do, this is what I've always done. How did you give yourself permission? Or maybe there wasn't permission, maybe it was a must, I have to kind of shift out of that and explore other options.
It kind of it all fell apart because I was going through a divorce. And so just leaving like a home of 25 years with a history of being adopted was so traumatic for me. And then being in COVID, my body was like, I'm out. Like and I realized, but I was very hard on myself. And I'm very lucky I had good friends with me that were, because I, but I was a mess, truly a mess. But then it also felt so good to let go. And I thought, I never take time off. I never, like, everything I tell my patients to do, I'm not doing. So, and it's like, I always thought I would retire doing this, and I felt like a failure, but I'm like, no, this is just part of the journey. And it's more who I am. I'm not meant to be on a computer for 12 hours. It just does not fit me. And I was struggling with that ethically. Like, I couldn't spend time with my patients, and it didn't feel good in my body. Yeah.
I love that you're giving permission to that, right? So, because there's other people who will be listening to this and saying, I feel like I've been a nurse, I'm always going to be a nurse, this is how I'm going to retire, or for a physician, or a radiologist, or anybody in a psychologist, that there are lots of intersections of medicine and other practices such as yoga for you that
Mm-hmm.
you can embrace and still be a healthcare professional, still
Mm-hmm.
be helping people heal. How
Mm-hmm.
how how have you kind of found that new identity?
With a lot of trust. And I mean, I was a little obsessive. I was looking for jobs, and finally I had to say, I trust this path. And then things just started opening up, and it's like my faith got so much bigger. And I'm like, moving to Oregon was very grounding for me. And with all the trees, like my mom passed away in January. So it was a lot of things. And I'm like, I really feel held and supported. And it's really, I don't think I would have survived in the hospital. And I had to honor that without feeling like a failure. It's okay to make mistakes. I think success is failing, and failing is such a horrible word. It's like it's okay. We're just human. Being loving to myself.
But you've said several times, like it's something that you felt. You had to listen to your body. Your body was telling you were crying during yoga. You didn't want to be on a computer. Like there were so many signals. But do you feel like people in healthcare are taught to pay attention to their body?
They are taught to, it's like, you signed up for this. We were told that you signed up for this. And I just thought this is not therapeutic during a pandemic for extended periods of time. And it was so great because I had two colleagues come out to Oregon, and we just had the best time, and they went back so refreshed. And it's like, let me show you the other side, like, and just like breathe and enjoy the nature and it's hard to do that when you're so hyper focused on, I gotta do this. And I'm very task oriented, and I felt like I was on a treadmill, and that was the hardest part, was because you feel like you're losing a part of your identity. That's how I felt anyway.
Yeah, absolutely. Yeah, thank you for sharing that. I think you're right. I don't think people are taught to pay attention to what's happening with their bodies. I don't think they're given permission to not just be producing. And there's this whole other part of is, folks right now who are really struggling because almost 3 years now of ignoring ourselves and what we're going through, and continuing, like you said, to perform, right? You showed up, you signed up for this is what you have to do. And so just even if someone's listening and just pausing and checking in with their body, right? And, how do we know in our body if it doesn't feel okay? Like if you're not a kind of person that checks in with your body regularly, would you give us just like 2 or 3 tips about, like, if this is my first time ever just like trying to take a deep breath and tune in, how would I know what's happening in my body?
For me, my sleep started being off, and then taking a breath, it feels difficult. So just really meeting yourself where you're at. And then, for so many years, I'd go to work like it was autopilot. And when I get to work, I would get teary eyed, like, oh gosh, not again, and I just thought, this is a postpartum floor. This should not be a big deal.
Yeah, this is a happy floor. Yeah. So I just want to reiterate: sleep disturbance, tightness in your chest, and then this, what I would call like depersonalization, right? You're going to work, you're on autopilot, but it's like you start crying because your body is saying, this doesn't feel right to me. I worked with a physician, and she said that she would drive to work on autopilot every day. And then when she got to the parking lot, she would have a panic attack. And she would force herself to go in and just put on her mask. And, she was having a panic attack underneath the mask. And just that feeling of like, I have to push through that.
Yes.
Yeah. Yeah.
And it's only 2 days a week, or it's only this, or it's only that. It's like, so then you feel less than, because yeah.
There's a lot of guilt in that. So what have you learned about how to take care of yourself?
I learned that when I let go, that my breath is going to be there for me, my spine, my nervous system is going to hold me, and my mind's going to be there. Like, I don't have to figure everything out and to stay, like, try and stay in this present moment. And I do a lot of the hand over the heart and feeling my feet on the earth.
Mhm.
I mean, if that's all that I teach the kids in recovery, I'm like, why did I never know this? You
It's
know?
everything. I mean, what you just said, right? Trusting that when I let go, my breath will be there for me.
Mm-hmm.
I mean, that's for some people a really big first step.
Mm-hmm.
Yeah.
Mm-hmm.
Okay, ready for some rapid fire?
Sure.
Okay. What's one thing that you think people get wrong about trauma-informed work?
That it's always dark and depressing and just yeah,
That
Debbie
there's
Downer.
light. Yeah, that there's
There
light.
is there is light, there's freedom in it.
Oh, I love that.
Mm-hmm.
If you got to go back to young nurse Lisa, what would you tell her?
I would tell her not to take things so seriously,
Mhm.
and that you don't have to be perfect.
Mhm. Perfect. On that
Mm.
note, I think often in healthcare, people think that, they're kind of intimidated by professionals. Can you share one thing that makes you a messy human? What's one thing that makes you perfectly imperfect?
Oh, I can just think of the one, like a few coworkers that just so close to, because we worked so many years. I mean, we go in the break room and we would just be laughing and singing and goofy as ever. And that's when my friends came out. That's what we did. And like not all being about work, but we stopped being able to get together and just be as humans, and not just nurses, so
Yeah, yeah.
yeah.
Thank you. All right, last one, hardest one. It's 11 p.m. and you have a food craving. What do you reach for?
Popsicles.
Popsicles. Any particular flavor or brand?
I like orange for some strange reason. I don't know why. And I like the no sugar ones. They're so good.
It's so funny. Maybe you have insight into this because you do so much body work. But a lot of people, when I ask them about this 11 p.m. craving, it's something cold. It's ice cream, it's popsicles. I wonder what's
Uh,
happening, like if our brain's needing to reset somehow. But
I feel like it's a reset. Like it's
yeah, yeah. Oh my gosh, that's great. Um, if people want to learn more about trauma-informed yoga, about that kind of work, do you have a favorite book or site or something that you refer people to?
I learned from Zabi Yamasaki, and she started transcending sexual trauma in all the UC schools throughout the United States. And she's amazing. Yeah.
Okay, so we will get that information. We will link up to it in the show notes. Lisa, thank you so much.
Thank you.
Thank you for sharing your story. I just know that stories have the power to heal, and that there's other people out there listening and may hear this and say, it's okay to do something different. It's okay to listen to your body.
Yes.
So thank you for sharing that.
Thank you so much.
Yeah,
It's great talking with you.
thank you.